Minister, thanks very much for your time.
Pleasure.
Much of the program that you've announced today is over a 6-month time frame. Why is it 6 months? Are you hoping it's going to be over by then, this virus?
So the program's been designed on the medical advice, not just the Chief Medical Officer, but all of the state Chief Health and Medical Officers who form part of what's called the Australian Health Protection Principal Committee. And we're looking at the likely course of the virus or the arc of the virus. The Chief Medical Officer today talked about the peak periods potentially being between 8 and 14 weeks, but we don't have exact science on that because around the world it's differing, and as he said, we've been able to delay and contain far better than many, many countries, which gives us more time. But what we've done is prepare for a 6-month period. If more is needed, more will be provided.
The Chief Medical Officer sounds quite sanguine, I think, if that's the word, about the impact here and potentially that Australia might be able to keep a lid on it. Is that still possible?
It's a focused but reassuring is Brendan's approach in all of this, and that is to say this is a challenge. We recognise that it's a pandemic, that it's a global virus, but that for young people they are less likely to be infected and less likely to have significant complications. Our area of greatest concern is the elderly and those with immune weaknesses, but what we're seeking to do through the primary care system, through the aged care system, through the hospital system and through our research program is to prepare Australians to have the best possible protection.
Well, in Italy, for example, more than 600 people have died already. It's not inevitable that we're heading to something like that.
Look,
is that the point?
What we've said is we're not immune, but we are not just well prepared, but as well prepared as any country in the world. Brendan's point earlier today was that we've been able to delay and contain far better than other countries have faced. That's not a criticism, that's more an acknowledgement of the degree of preparation, the early action and Australia's circumstances all coming together.
So that sort of scenario is not inevitable, that we end up with hundreds losing their lives?
We will have more cases and that will continue to grow. We are all preparing for expansion, and I think it's very important for me not to be unrealistic in the picture, but to say in primary care, for example, people will be able to visit their GPs if their GPs feel they're equipped to see them, the hospital emergency departments, or now telehealth, which will start on Friday, and then the pop-up respiratory clinics. The states have already established some and are doing a great job, I have to say.
Have you got the GPs to staff those clinics? Because there's 100 clinics, seeing 75 people a day for 6 months. That sounds like a lot of work. Are there the doctors to do it?
So some of them will be existing clinics that may seek to turn themselves over to be primarily a coronavirus clinic. Others are setting up smaller programs as sub-clinics. I'll give you an example. In the western suburbs of Melbourne, former AMA President Dr Mukesh Haikerwal has established a drive-through clinic next to but separate from his current clinic. Really creative, and so we're supporting all the different approaches to provide people with as many avenues as possible on top of the existing system.
And there are the doctors to do the job?
Yes.
Because it sounds like a big task.
Look, it is, and what we're doing is providing that additional workforce. There will be times where people may have to be patient and wait, and if you think of the summer we've just had and some of the natural disasters, but the spirit of Australia in that situation was about helping each other and understanding. Well, this is the same thing, that this is the equivalent of a natural disaster, but it's different from something most people have experienced. It's an epidemic that is travelling around the world. So we are not immune, but we're taking those steps off a well-prepared plan. Today is the latest step in that, of implementing that plan with the telehealth, the additional tests through what are called pathology tests, specifically for the first time a coronavirus test, which will be will expand the capacity for the public through the what's called the private network, and then the respiratory clinics.
And in terms of the vaccine, Dr Murphy said that it's probably going to be a year at the earliest before something is in place. But then the Prime Minister made the point, and if you could elaborate for us on this, because it's interesting, is that there are other medical advancements happening in dealing with COVID-19? What exactly are you talking about?
So if you think of the four pillars of our health system, we have primary care, which we've just talked about, the aged care, the hospitals and research. We're putting an additional $30 million into research. Now that will help with vaccines, part of a global process, but also antivirals. Antivirals are about helping people to defeat or clear the virus. We don't have an answer globally yet, but there is some prospectivity on that.
And that happens sooner than the vaccine?
That has the potential to come online even earlier than the vaccines. And then thirdly, there is respiratory medicine, or sometimes in this case what might be called immunotherapy, which is helping to mitigate the effect of liquid in the lungs, which is the principal complication that has led to the most serious cases in the majority of cases where they have been critical.
Your British counterpart has contracted coronavirus. It's been reported today. Chris Bowen, the Shadow Minister, says a substantial part of the population in Australia will end up getting coronavirus. Is that too pessimistic, that outlook?
Look, I apologise, I hadn't heard of that latest development from Britain. I've been working with the Prime Minister today. But what I would say is this, as I said on the weekend, over the course of the coming months, most of us in some way, shape or form will be connected with somebody. Now that may be 1 or 2 degrees of separation, and so we have to acknowledge and accept that in the same way that in a significant flu season, most of us would be connected with somebody. That gives you a sense of the connections, but that's why we have to do two things. One is, as a government, prepare and support, but as a community, to prepare and support, to be recognising that each of us has responsibilities in terms of hygiene and reducing the risk of infection, but also supporting. It could be the elderly couple next door that for some reason may be in isolation, to perhaps collect the shopping and leave it for them, to help out each other. That's, in all of this, the potential for Australia to be its absolute best self. And I believe in us, and I believe in our ability to do that. At times we haven't been, have we, in the last few weeks? There have been scenes of panic buying in shopping market aisles and so on, some fights, charges laid. I mean, so far there have been a few isolated examples, to be fair, but so pretty ugly. I would say they are isolated cases, they are outliers. This sense of who we are as a country, we showed that over the summer, we showed that capacity, that's who we really are. And right now, what we're saying to people, although we're used to dealing with floods and fires and cyclones, and this is unusual, this, though, is the same spirit of resolve and of strength and of support and of compassion, which we apply to all of these natural disasters. That's what we're asking Australians to consider, because we believe in who we are, but we're providing the health support to back that up. We've seen the Irish, they've shut down St Patrick's Day parades, they don't want mass gatherings there. We've still got major events happening like the Grand Prix, the football season about to start. Will the government amend that position if needed in terms of mass gatherings? Is there the chance that we see football matches in empty stadiums? So the way we're approaching this is the medical advice. For example, we had medical advice in relation to Italy, and the National Security Committee this morning made a rapid decision to close that down. The medical advice is certainly not ruling out that potential, but as Dr Murphy said only this morning, we're not at that stage. There's one example of community outbreak in parts of northern Sydney, but more significantly across the country. At the time of coming to air, we're on the advice of the National Incident Centre at 112 cases in Australia, across all of Australia. And so as more steps are needed, we won't hesitate to take them, but we will take them off the best medical advice. It would be premature to shut down major events as of now. That's the medical advice that we have, and we've got ahead of this. We've been able to delay by containing, by mitigating, by taking steps, not immune, but we've been able to delay and therefore flatten the impacts by following that medical advice. And so we've worked hand in glove with them. We've given them the freedom to do that, and by working with our amazing doctors and nurses, our medical advisors, that gives Australia the chance to be the best prepared country and the best protected country in the world.
Minister, I appreciate your time. Very busy day for you. Thanks so much.
Thanks, Kieran.